Hi, I'm Michael Klosowski, Managing Editor of InsideARM.com. And as we wrap up the healthcare big issue on our site, I wanted to take a few moments to share some of my thoughts as we close out this content series. First, I wanted to thank our sponsor, Probate Finder On Demand, whose support of this series has allowed us to bring a variety of industry perspectives to the issue of healthcare and healthcare receivables. Secondly, I wanted to thank a range of those contributors from the industry who brought their expert insights from a variety of perspectives to bear on the content that we published. As we close out the series, I just wanted to leave you with a few thoughts about why this series was important for us to publish and where I think some of these issues around healthcare and healthcare receivables are going. First, as we launched the series, I began with a piece that simply said, healthcare is a big issue for the ARM industry. This is an obvious statement, of course, because the healthcare market for receivables, for healthcare collections, is certainly a sizable market in the space. But more importantly, as an industry that employs hundreds of thousands of people across the country, many of them in small businesses, healthcare insurance, healthcare reform, healthcare benefits are all important issues to people in this industry simply because they have employees who reform kinds of issues will impact. So regardless of what kind of paper you particularly might work, healthcare is something that, of course, we all sort of need to pay attention to. Secondly, while we all know right now that the question of where the current reform bill is going is a little bit up in the air, I think that it is safe to say that healthcare collections is a growing market for the ARM industry. If for no other reason than that the current bill, which is, or the current law which has been enacted, doesn't at this point do anything to address existing bad debt. And so until 2014, when the bulk of the patient side or consumer side planks of the law take effect, not only will the existing bad debt that's there and being worked continue to persist, but it will also continue to grow. And so opportunities exist certainly for folks who are already working in the space and for those who may be interested in entering the healthcare receivables market. Finally, I just wanted to give a little bit of perspective on my position regarding reform itself. And I think that on a broad level for this country, for a variety of reasons, reform is important. I simply don't believe that the current system is sustainable without significant kinds of reform. The ultimate form that legislation takes is, of course, debatable, but I do think that it's important. And I think that there are two things specifically that make reform important ultimately for the ARM industry. The first is that on the provider side, the adage forever has been that self-pay means no pay. And one of the challenges that folks who are working in this market today face is the fact that medical bills that patients incur, while certainly a viable market for collections, are also a difficult market for collections. And so one of the things that I think is pretty clear about what reform might do is not only create different kinds of markets, because, for example, you will have still a decent volume of accounts, but lower balance accounts, which make them perhaps more collectible. But in addition to that, significant kinds of insurance reform will ultimately change the way in which patients are documented. And as a result, when you have more folks who are ultimately not in a self-pay bucket, but who are in fact have some kind of coverage one way or another, the ability to ultimately be able to collect on those accounts when needed will become significantly easier under reform efforts. Just a couple of, like I said, just a couple of personal takeaways on the issue. We, of course, in Inside ARM will continue to cover this issue and other issues that we see as big and impacting the entire ARM industry.